Welcome to Senior Health Video. This video will talk about dangerous symptoms of lupus that you may have overlooked. Have you ever felt tired in a way that sleep could never fix? The kind of exhaustion that seeps into your bones, that clouds your thinking, that makes you feel like something deep inside your body is fighting a battle you cannot see. For millions of people across America, this is not just fatigue. It is a warning sign, a red flag waving silently beneath the surface. What if that tired feeling was not just stress or aging? What if it was your immune system turning against you, quietly, slowly, day after day? And what if no one believed you? That is the terrifying reality for those living with lupus, an autoimmune disease that affects over 5 million people worldwide. A disease so sneaky it often takes 6 years or more to be correctly diagnosed. And during those years, symptoms come and go. Doctors dismiss it as anxiety or aging. Meanwhile, inflammation spreads through the joints, the skin, the lungs, even the brain. Lupus is a master of disguise. It mimics other illnesses. It flares without warning. And worst of all, it hides in plain sight. By the time most people discover what it is, damage has already begun. But what if that could change? What if recognizing the early signs gave you the power to stop it? To protect your organs, your memory, your future? That is what this video is here for. To break the silence, to name what has been ignored, and to show you the 15 most critical symptoms of lupus that may already be showing up in your body or in someone you love. Backed by science, explained in plain English, with real hope and clear next steps. Because healing starts with knowing, and when you understand the truth, you can finally take back control. This could be the turning point. So stay with us, because what comes next might just change everything. Number 1, fatigue. What if feeling tired was not just normal aging? What if it was your immune system quietly shutting down your energy from the inside out? That is exactly what happens in lupus. This is not just being tired, it is deep physical fatigue that sleep cannot fix. Your body feels heavy, your mind is foggy. Getting out of bed feels like climbing a mountain, and no one around you understands why. Lupus causes widespread inflammation, which affects your muscles, brain, and even your blood flow. That leads to a constant feeling of being drained. It is not laziness. It is your body screaming for help. A 2021 study published in Rheumatology and Therapy revealed that 90% of lupus patients report chronic fatigue even when their disease appears to be under control. Doctors often miss it. Blood tests may look fine, but deep inside your cells are under constant attack. So what can help? Gentle movement like stretching or walking? Staying hydrated. Keeping a daily fatigue journal. And most importantly, bring it up with your doctor again and again. Your story matters. But just recognizing fatigue is not enough, because the next sign could appear right on your skin, and it is one of the most recognizable warnings of all. Number 2, butterfly rash. Fatigue may be silent, but this next sign is one you can see right on your face if you know what to look for. Many people with lupus develop a red inflamed rash across the cheeks and the bridge of the nose. It is often shaped like a butterfly. This rash is not just cosmetic. It is your immune system attacking healthy skin cells after exposure to light or stress. Doctors call it a malar rash. And here is what makes it so specific to lupus. It usually spares the folds between your nose and mouth, which helps tell it apart from other rashes. According to a 2023 study in Clinical Dermatology Review, up to 80% of lupus patients experience skin symptoms, with the butterfly rash being one of the most recognizable. Sometimes it is subtle. Other times it flares up after just a few minutes in the sun. Either way, it is more than skin deep. It can be a signal of inflammation in your entire body. So what can help limit sun exposure? Wear protective clothing and SPF 50 sunscreen, and take photos of the rash to show your doctor when it fades. But just spotting a rash is not enough, because the next symptom might show up without a single mark, and it can strike in ways you would never expect. Number 3, photosensitivity. Not all lupus signs are visible at first glance, but sometimes just stepping into the sun can unleash a wave of damage beneath the skin. Photosensitivity means your body overreacts to sunlight, and in people with lupus, even mild exposure can trigger painful rashes, swelling, and crushing fatigue. What looks like a relaxing walk can leave your body inflamed for days. This reaction is not just surface level. A 2022 study in Frontiers in Medicine found that lupus patients have altered skin cell pathways. Sunlight triggers cell death faster than normal by disrupting proteins like YAP and WWC1. When that happens, inflammation spreads not only on the skin, but inside the body too. So what can you do? Wear wide-brimmed hats, use mineral-based sunscreen daily, avoid peak UV hours, and if you notice symptoms after time in the sun, document them. Patterns can help your doctor make a faster diagnosis. Photosensitivity often appears before lupus is fully diagnosed, making it an early but powerful clue. But just protecting your skin is not the end of the story, because the next symptom strikes deeper than the surface. And this one often hits where people least expect it, the joints. Number 4, joint pain and swelling. If the sun can trigger inflammation on the outside, lupus can do something even worse. It can turn your immune system against your joints from the inside. Many people with lupus wake up to stiff fingers, swollen knees, or aching wrists. At first, it may seem like arthritis or just getting older. But when the pain keeps moving around or strikes both sides of the body equally, it points to something deeper. Lupus-related joint pain is caused by chronic inflammation, not just wear and tear. A 2023 study published in Diagnostics used musculoskeletal ultrasound and discovered that many patients had internal joint damage, even when the outside looked normal. That means you could be experiencing real damage long before it shows on X-rays or blood tests. The good news, anti-inflammatory foods like omega-3, rich fish turmeric, and leafy greens can help. So can low-impact movement like swimming or yoga to keep your joints flexible without triggering flares. And do not ignore patterns. If your pain is symmetrical, persistent, or worse in the morning, write it down and bring it to your doctor. Early intervention can prevent long-term joint damage. But just watching your joints is not enough, because the next symptom can appear suddenly without warning and mimic something far more dangerous. Number 5, unexplained fevers. After the pain settles in your joints, something even more alarming may begin: a fever with no cold, no flu, and no clear reason. Many people with lupus experience recurring low-grade fevers that come and go without warning. You might feel fine one day and then suddenly flushed, achy, and drained the next. It is easy to brush off. But these fevers are not random. They happen because your immune system is in attack mode, triggering inflammation throughout your body. A 2018 study in Curious found that up to 86% of lupus patients experience fevers that are not caused by infection. These flares are a sign that something deeper is happening, often before any lab result can catch it. So how can you respond? Start tracking your temperature daily. Note when fevers appear and what symptoms follow. Keep a log and share it with your doctor. This small habit can help uncover invisible patterns and lead to faster diagnosis. You can also support your body with cool compresses, hydration, and gentle rest during flares. Do not wait until the fever spikes. Catch the pattern early. But just knowing about fever is not enough, because the next symptom might show up quietly in the mirror or your hairbrush, and it often gets dismissed when it should be taken seriously. Number 6, hair loss. When a fever passes, you might think the worst is over, but then you look in the mirror and notice your hairline thinning or strands collecting on the pillow. At first, you blame stress or age, but in lupus, this could be something far more serious. Hair loss is one of the most overlooked signs of autoimmune activity. With lupus, your immune system may target the very roots of your hair. The result is diffuse thinning across the scalp or small bald patches, often paired with brittle or broken hair near the front. A 2021 study in clinical cosmetic and investigational dermatology revealed that a large percentage of lupus patients experience hair loss even before diagnosis, often linked to inflammation in the skin and scalp. It is not about vanity. It is a warning sign your body is under attack. So what can you do? First, avoid heat styling and harsh products. Use a wide tooth comb. Add nutrients like biotin and omega-3s to your routine. And if the shedding worsens or patches appear, document everything and see your dermatologist or rheumatologist. Hair loss may seem minor, but it tells a deeper story, and just noticing it is not enough, because the next sign, it hides inside your mouth, and most people never think to check. Number 7, mouth or nose ulcers. After noticing changes on the outside, it is time to pay close attention to what is happening inside, starting with your mouth and nose. Painless ulcers or sores inside the mouth or nose may seem harmless at first. You might dismiss them as a reaction to spicy food or a small injury, but in lupus, these persistent sores are signs of deeper immune dysfunction. These ulcers often appear on the roof of the mouth, tongue, or inside the cheeks. A 2023 meta-analysis in BMC Oral Health examined over 50,000 lupus cases and found that oral ulcers were present in nearly 30% of patients, especially during disease flares. Some appeared without pain, making them even easier to ignore. The immune system attacks the mucosal lining, leading to irritation, dryness, and small lesions. These may heal quickly or linger for weeks. Either way, they are not just random mouth sores, they are internal alarms. To protect yourself, maintain excellent oral hygiene. Use alcohol-free rinses. Keep your mouth hydrated. And if ulcers return, frequently take photos and log when they happen. Even something as small as a sore can be a major clue. But just catching that signal is not enough, because what comes next affects your fingers and toes, and it often arrives when the temperature drops. Number 8, cold fingers or toes that change color. After spotting hidden signs inside the mouth, your hands and feet may be the next place lupus quietly leaves its mark. Have your fingers ever turned white or blue, in the cold gone numb, while doing something simple like holding a cold drink or stepping into a chilly room? That could be more than poor circulation. It could be Raynaud's phenomenon, a vascular red flag often linked to lupus. In people with lupus, inflammation causes blood vessels to spasm and restrict blood flow, especially in response to cold or stress. A 2023 study in the International Journal of Molecular Sciences found that Raynaud's doubles the risk of pulmonary hypertension in lupus patients, a condition that affects blood pressure in the lungs and can become life-threatening if ignored. The color change happens in phases: white, then blue, then red, as circulation returns. These episodes may last minutes, but they reveal a serious underlying vascular issue. To manage it, dress warm even indoors. Avoid stress and sudden temperature drops. And talk to your doctor about medications that improve circulation if symptoms persist or worsen. Your body speaks in color too, and this one cannot be ignored. But just knowing your fingers change shade is not the full picture. Because what comes next can feel like a heart attack, but starts with your lungs. Number 9, chest pain or shortness of breath. If your fingers can signal trouble with blood flow, your chest may be the next place lupus makes itself known, and this time it feels a lot more terrifying. For many people with lupus, sudden chest pain or the feeling of not being able to catch a full breath is common. At first glance, it mimics a heart attack, but in many cases it is caused by inflammation in the lining of the lungs, a condition called pleuritis. Every breath becomes sharp. Coughing makes it worse. Lying down feels heavy. According to a 2023 study in Lupus Science and Medicine, over 50% of lupus patients experience some form of lung involvement, from pleuritis to fluid buildup or inflammation inside lung tissue itself. This symptom can strike early in the disease or come and go during flares. Either way, it is never something to ignore. If this happens, seek medical attention immediately. Get a chest X-ray or CT scan to rule out infection or other causes. Use breathing exercises to reduce anxiety and inflammation, and work closely with your care team to monitor lung function long-term. The lungs often suffer silently in autoimmune disease until they do not. But just knowing this could happen still is not enough, because what lupus can do to your brain might be even more unsettling. Number 10, brain fog and memory issues. If lupus can squeeze your lungs and tighten your chest, what happens when it turns on your brain? Many people with lupus experience something they cannot quite explain: forgetting appointments, losing focus mid-sentence, struggling to find the right words. This is not just being tired or distracted. It is a deeper issue often called lupus brain fog. This kind of cognitive dysfunction affects memory, focus, mental clarity, and verbal fluency. According to a 2023 study in BMC Neuroscience, patients with higher disease activity showed measurable declines in executive function. The culprit: oxidative stress and chronic inflammation, disrupting how the brain processes information. Some patients also reported mental fog after starting corticosteroid treatment, a common medication for lupus. So it is not just the disease. Sometimes the treatment plays a role too. What can help keep a journal of symptoms and triggers? Focus on one task at a time. Try brain-boosting foods like blueberries, leafy greens, and omega-3s. And if the fog worsens, talk to your doctor. Cognitive testing may help tailor your care. Your thoughts matter, and lupus can cloud them before you even realize it. But just protecting your mind is not enough, because what lupus can do to your kidneys might remain hidden until it is almost too late. Number 11, kidney problems. If lupus can cloud your brain, it can also quietly damage your kidneys long before you feel anything at all. Your kidneys filter waste and balance fluids. But in lupus, the immune system can attack these vital organs without warning. This condition is called lupus nephritis, and it often begins silently. No pain, no swelling, no obvious signs, until it is serious. Sometimes the only clues are foamy urine swelling in the ankles or changes in blood pressure. But by the time these show up, inflammation may already be progressing. A 2023 study in nephrology dialysis transplantation found that patients with lupus nephritis had a 2.45 times higher risk of developing chronic kidney disease when inflammation in the kidney cortex was left untreated. That makes early detection not just helpful, it is life-saving. So what can you do? Ask for regular urine tests if you have lupus or unexplained symptoms. Monitor blood pressure closely. Drink enough water to support filtration, and if you notice anything unusual, speak up immediately. The kidneys often suffer in silence, but you do not have to. Still, just watching your kidneys is not enough. Because what lupus can do to your immune system and lymph nodes might be the body's next desperate cry for help. Number 12, swollen lymph nodes. If the kidneys can suffer in silence, your lymph nodes might be shouting for help, but no one is listening. Swollen lymph nodes are often written off as signs of a cold or mild infection. But in lupus, they can be one of the first visible signs that your immune system is under serious stress. These small lumps may appear in the neck, underarms, or groin, and may be painless at first, but they should never be ignored. Lymph nodes are part of your immune defense. When lupus causes inflammation, these nodes enlarge because the body's confused and attacking itself. A 2025 study in Lupus Science and Medicine revealed that patients with swollen lymph nodes also showed higher levels of autoantibodies and more frequent flares. In some cases, specialized immune cells known as Langerhans cells were found building up inside the nodes, a rare immune reaction that may signal more aggressive disease activity. What can you do? Gently monitor the size of any lymph node swelling. Track how long it lasts. And if it becomes persistent or is accompanied by fever, fatigue, or weight loss, get it checked right away. Imaging or a biopsy may be needed for clarity. Lymph nodes are like silent alarm bells, small but powerful. But just noticing them is not enough, because the next symptom may leave a visible mark on your skin that carries lifelong consequences. Number 13, skin lesions that don't heal. If your lymph nodes are quietly inflamed, your skin may be screaming in plain sight, and most people never realize it. Not all lupus rashes look like the classic butterfly shape. Many show up as dry red patches or scaly circular spots, especially on the face, scalp, chest, or arms. They can itch, scar, or even lead to permanent hair loss. These are not cosmetic issues. They are signs of your immune system attacking the skin itself. Some people develop discoid lupus lesions, which leave thickened scars that do not fade. Others get subacute cutaneous lupus with flat red patches triggered by sun exposure. A 2023 article in the Journal of Clinical and Aesthetic Dermatology found that early recognition of skin changes help reduce long-term scarring and internal flare-ups. So what can help avoid harsh soaps and sun exposure? Use gentle moisturizers with ceramides. Take pictures of any lesions for your doctor. They may look mild to you, but reveal deeper activity under the surface. Your skin is more than a surface, it is a diagnostic tool. But just watching for skin damage is not enough, because the next symptom affects how you eat, talk, and see the world, and it starts with something as simple as dryness. Number 14, dry eyes or dry mouth. If your skin is sending warning signs on the outside, your eyes and mouth might be whispering warnings from within. Many people with lupus experience chronic dryness in the eyes and mouth. It feels like sand in your eyes or cotton in your mouth, no matter how much water you drink. This dryness is not just uncomfortable, it signals that your immune system is attacking the glands that produce moisture. A 2021 meta-analysis in BMJ Open found that dry eye disease is one of the most common ocular symptoms in people with systemic lupus. And for many, it overlaps with secondary Sjögren's syndrome, a condition that further disrupts saliva and tear production. This can lead to blurry vision, burning eyes, difficulty swallowing, hoarseness, and even increased risk of tooth decay and mouth infections. It affects how you eat, speak, and see, slowly draining comfort from your daily life. So what helps? Use preservative-free artificial tears. Suck on xylitol mints to stimulate saliva. Stay hydrated, avoid alcohol-based mouthwashes, and let your doctor know, because these subtle changes are part of a much bigger picture. Your mouth and eyes may dry out, but your body's not being quiet. It is asking for help. But just treating dryness is not enough, because the final symptom we are about to cover could impact something even more life-changing, especially for women. Number 15, blood clotting or pregnancy complications. If dry eyes and mouth make daily life uncomfortable, this final sign can quietly shape your future in heartbreaking ways, especially for women of childbearing age. Lupus can trigger the production of antiphospholipid antibodies, which increase the risk of dangerous blood clots. These clots can form in the legs, lungs, brain, or placenta. The result: recurrent miscarriages, strokes, or life-threatening pregnancy complications. Some women only discover the issue after multiple pregnancy losses, often in the second or third trimester. A 2025 study in BMC pregnancy and childbirth confirmed that antiphospholipid syndrome is a leading cause of fetal loss and preeclampsia in lupus patients. This condition often goes undiagnosed unless doctors know to look for it. What can help? Get tested for antiphospholipid antibodies if you have lupus and a history of miscarriage or clotting. Treatments like low-dose aspirin or heparin can dramatically reduce risks. And for those not pregnant, knowing your clotting risk early can help prevent strokes and heart complications later in life. Sometimes the most dangerous symptoms leave no visible sign at all until it is too late. But just knowing the signs is not enough, because what you do next with this information could change everything. You have just learned about the 15 most dangerous yet often ignored symptoms of lupus. Some are silent, some are visible. Some may already be happening in your body or in someone you love. But now you know what to look for. You have the knowledge to act. Lupus is not always loud. It does not always come with sirens or sharp pain. Sometimes it whispers through fatigue or foggy thinking. Sometimes it hides in your skin or behind a rash. But the truth is this: you are not powerless. There is no cure for lupus yet, but there is hope. Early detection and the right lifestyle choices can make a real difference. You can protect your heart. You can reduce flares. You can support your immune system with better food and smarter habits. And you do not have to do it alone. If this video helped you recognize something new about your health, please save it now so you can come back to it anytime. It might also help someone else. Share it with a friend or a family member who needs it. You could be the reason they catch the signs early. Subscribe to this channel for weekly videos on science-backed senior health tips, food choices that fight inflammation, and simple routines that protect your future. Turn on the bell so you never miss out. Your body is not your enemy. It is your guide. It speaks in signs, and now you understand them. Let today be the day you take your health into your own hands. And in our next video, we will show you the 4 most dangerous foods that can trigger autoimmune flare-ups after age 60, and what to eat instead to calm your immune system naturally. Until then, stay informed, stay hopeful, and always remember, it is never too late to change your health story. Save this video, hit subscribe, and take one small step today that your future self will thank you for.